Thyroid imbalances are amongst the most common causes of low energy. It's in epidemic proportions. If you're a healthcare provider, a doctor, nurse, a naturopath, any sort of provider, you see this a lot in your practice. Unfortunately, medical training does not properly prepare you for helping people to truly reverse their thyroid problems. You probably just know about testing TSH and then giving a person T4 supplementation. There's so much more, and you need to know it if you want to be successful at helping these people get well. So today I'm sharing with you a recording from my podcast, an interview that I did with Dr. Lisa Lewis. She's a naturopathic physician, a functional medicine doctor, nutritional endocrinology practitioner, and she has an approach that helps people to actually get to the root cause. Because this is a podcast, well, what's going to happen is it's just audio. So you can listen to this in the background while you're cooking, while you're doing other things. You don't have to be actively watching it. And that's good news. So I'm Dr. Rita Marie-Loscalzo, and really want you to tune in at this channel. We are dedicated to helping health practitioners of all kinds to learn how to use functional nutrition and get people truly well. So listen up. Thyroid conditions are reaching epidemic proportion. There are so many people on thyroid hormones, and for so many, this is not the right approach. We know that the main function of thyroid is to control the metabolic rate of every cell. So how do you, as a practitioner, determine the best approach to optimizing thyroid function and to help people have the energy they need and want, not just for the fun and recreation they desire, but for the energy required for proper function of their glands and body organs? To help us today to dig deep into thyroid health, we have a special guest, one of our nutritional endocrinology practitioner training students and a doctor of naturopathy with over 20 years of experience, Dr. Lisa Lewis.
Things is to bring more fun and joy to healing, as well as help people reconnect with that inner child that they lose when they become adults.
When they grow up, right? I don't want to grow up. Was that Peter Pan, right? Let's start the Peter Pan syndrome. Oh, funny. Yeah. And our audience is mainly our colleagues, right? Health practitioners dedicated to truly helping people to get to the root causes rather than just covering up symptoms, which is the Western medicine approach. And we see so many people with symptoms of thyroid imbalance, some that have already been diagnosed, and some of them are on hormones and some of them are not. So I just want to ask you a couple of questions before we dig right into thyroid. Is like, with all your education and certifications, what prompted you to join our nutritional endocrinology program? What do we have to offer you that you didn't get elsewhere?
Well, I always like to liken it to continuing education first. And then second, having a community of practitioners who are dedicated to the same, not just cause, but even the same areas of expertise. Because even though there's a lot of naturopathic doctors out there and functional medicine doctors out there, they don't, I don't believe that the endocrinology focus ties us together. And I think this endocrinology focus, you teach us so much that we did not learn in naturopathic school. Now, I know I'm 20 years out, so of course, I'm sure the education is a little bit different today. But the level of expertise and knowledge that's necessary today to deal with the common and or the most prevalent hormonal challenges are learned in a way that I just don't think that they're taught anywhere else. I'm just going to say it. Right? There it is. I do a lot of continuing education. I mean, I do both the business continuing education and the medical, right? Because of course we're practitioners, so we also are running a business, so we can't delineate. We have to become good at both, right?
Absolutely.
but the true nature of what you teach in the endocrinology, the nutritional endocrinology program is a culmination of all of that. So even if someone said, okay, I'm the smartest person on the universe, you know how people graduate from school. They think,
Yep.
right, I know everything. And I just graduated and I know everything. The way to build a practice in today's world, the changes and the shifts that are taking place in our world every day, there's a combination, because most people think, oh, she's teaching nutritional endocrinology or she's teaching something I already know. But I can tell them that I know they did not get the level of business knowledge and education that you teach either, right? Like I can just tell you, I had a practice management class. That was that was the extent of what we learned to, right?
Right.
Right?
Yeah. Exactly. And what it was sign up with this practice management firm and they'll get you all the patients you need. And what we all found, I didn't do that signing up with them. I just watched my colleagues do it. It didn't work. And it was certainly, it might have worked then, 20, 30 years ago when we graduated, but it doesn't work now. It's a totally different world. So completely. I think we have to make sure that we know how to reach people. And, back then, there were not summits and blogs and podcasts like this all over the place for people to learn good stuff and maybe some misinformation from.
Yes.
So there's a lot of different things to deal with. So thank you for sharing that.
Yeah, so it's that three-pronged approach. It's the community, the business, and a much deeper knowledge of the science and the practical application of it, right? Because I learned a lot of things that when I got out of school, that they just weren't practical. I was not going to get the average patient to do most of the quote unquote processes and protocols and, over the edge elimination diets. And I just, we have to learn to work with people where they are. And I really think that you teach an amazingly practical approach as well as an approach that helps us think and become our own practitioners, but also helps the patients and or customers or clients. I'm not sure what people call them.
Whatever they call them. Probably not customers, but probably more like clients or patients, right? The people, the hearts, right? The people who have lives and hearts. And I think that we need to really maintain that connection with people. It's not just about, Mary, you've got these things on your labs. Here's the herbs you're going to take for it. No, it's really connecting with people. And I think that gets lost in our modern medical system, whether it's naturopathic or functional medicine or conventional Western medicine.
And that approach, that personalized, as customized as things are, I still think the heart connection, because I focus a lot more on mind, body, spirit than what I was taught in school. I think most of the people that show up for me are people that may have had some of the same experiences that I've had, because we attract who we are, or at least who we were.
Right? Yeah.
And so a lot of them do need to heal on a different level because they have experiences and things that they've been exposed to all of their lives that they may not even realize are having an impact on their body and their thyroid and their hormones and all of that. And so if we just show up with protocols and, supplements for them to take and not go deeper and understand their history and not just, what did your parents' conditions have, but really understand what's happening with them and not just ask the questions, but apply it to what they're going through right now, like the physical manifestations of all of that. That's really, I think, where I connect most with the people that show up for me.
Well, I love that. I love where this conversation is going because that is such an important piece of it. And sometimes as practitioners, we get so caught up with what do the labs mean and what supplements do I need and what foods. And we forget about some of that like internal, that emotional trauma that they're going through, that even if you put together the most amazing protocol for them, they may not be able to follow because there's things, those things that get in the way. of letting them follow through. And when we can sit with people and help them to truly get to the heart of what's holding them back, a lot of times it's not just the knowledge, it's more than that, right?
That's it. And, a funny story, I didn't just show up to Dr. Rita Marie as a student. I showed up, I don't know, almost 10 years ago as a client, right?
Right.
So I started using your work first, and all the programs that I did, whether it was the cortisol, at that time was the cafe program,
Yes.
right? And Thyroid Revive and Thrive and all of these amazing programs, the Green Cleanse and all that. It's so interesting that I kept going back to my lifestyle, not just the lack of sleep and all of that, but mine has always been the way I push myself and the amount of stress that I put on myself. And I can connect that to when I was a child. I've been a driver ever since I was like 4 or 5 years old, probably 3. Like I was started reading. I started reading and wanted to go to school when I was 3, right?
Holy cow. The overachiever, and you came out so early.
Well, I actually had older brothers and sisters, and I would watch them do their homework, and then all of a sudden I started doing their homework, and then like, time for you to go to school, right? But all of that to say is when this pandemic hit, and I had to slow down on some level, shifting the way that I was practicing, not working at the office until the wee hours, and just staying up and studying cases all the time, was the first time I officially had a perfect cortisol across the board, sleeping like a baby, just doing all the things that having the opportunity to spend more me time. And I recognized, I've always known that the stressors and the driving and the pushing was my Achilles heel. But when you work so hard and you want to change the world and you're doing so much and you're the person that everyone comes to for support, you really want to give your all and give your best. And at some point you have to recognize that is a pattern, that is an archetype that creates dis-ease, right? And that's one of the archetypes that I found in women that have hormone imbalances, and especially with thyroid.
Yeah. So thyroid, we're all the way back to thyroid. Yeah. Oh, I love what you shared, and it rings true for me too. And it's like a reminder for me that we can't keep push. We do have to slow down to speed up, so to speak. So let's talk thyroid. Okay. So I know I've seen you do like challenges and things like that on the thyroid. So tell us a little bit about why you do that and like, what's the problem with the Western approach, starting with assessing the thyroid?
Yeah, sure. Well, the reason why I try to do so many challenges and programs to build knowledge and awareness is because what I found is that either people have a gamut of symptoms and or imbalances, right, that show up as a thyroid, either underdiagnosed or misdiagnosed, but either way, they're suffering for years. And they're treating everything around it because thyroid, I found like low thyroid symptoms can be found inside the adrenal symptom picture. And there's so many like low energy or fatigue, digestive issues, hair thinning and loss, headaches and dizziness, all of these primary symptoms that are also attributed to thyroid or attributed to other common diseases. So what I find is that people tend to address all of those diseases, but they don't look at them all together, like as the holistic perspective and say, okay, what few conditions would show up with all of these, as opposed to looking, a lot of practitioners kind of pulling out 1 or 2 symptoms and going, okay, there's the problem. When symptom is that's just the symptom. That's not the disease, right? That's the Band-Aid, right? So a lot of people they're suffering significantly, and they just don't know what else to do because they've even tried all the diets, to the best of their ability. They say, I eat right, or I've been exercising, I've been doing so many things, cannot seem to lose weight or get my digestion under, in some level, reduce the constant get poop on a regular basis, right? Like, I mean, people just, the basic tenets and the basic things that we take for granted, people are out there suffering from. And so if I don't get to the general person, the person out there that probably wouldn't show up at my office or click on a link online, right, to schedule a consult, if I don't get to that person, then I'm missing so much opportunity to have a greater impact. And so there's things that I have to do outside of the office that are going to reach them. And that's the biggest reason why I show up in online space and doing that kind of work.
So when these folks have been suffering, like you said, constipation, hair loss, low energy, elevated cholesterol, right? And they're treated with statins, or they're told to take laxatives, or they're depressed, so they're given Lexapro or something like that. How do you get to the heart of it with the thyroid? Where do you start with them? Because some of those things can be other things, right?
Yes. I mean, and they probably are, right? They're a mixture. And that's the beauty and the curse around thyroid, right?
Yeah.
Because it is ultra complex. There's no one way to address it because there's so many systems that are either out of balance because the thyroid is out of balance, or that have gone out of balance and therefore have pushed the thyroid out of balance, right? And so which comes first, the chicken or the egg, right? Pretty much doesn't matter because those symptoms are showing up. And so how I start everyone with, of course, the comprehensive talk, the consult, because I have to know who they are. I'm not treating a symptom, I'm treating people, right?
Right.
And so when I can understand what their world is like and what their world has been like, then that helps me to taper down a little bit more and to start to see where I need to look. But to be clear, the medical detective work starts around comprehensive blood chemistry panel, the standard glucose, BUN, creatinine, ALT, ALT, like all of the primary labs that you get every time you go to get a significant, significant doctor's visit, right? And the CBC. And then I also add in inflammatory, do things a lot more comprehensive than just the standard CBC and blood chem panel, like the inflammatory markers. I always test the saliva cortisol levels and hormones. And then I analyze them based on the functional medicine approach, looking at them for optimal levels, looking for wellness, not necessarily looking for disease, right? So I'm sure, your listeners have heard this, but the standard range of most biomarkers are pretty wide, and or at least all of them have a Goldilocks zone. All of them have a place where if health is perfect and everything was in alignment, that's that range. So I'm assessing people based on that range, not the outskirts, not the upper end or lower end of normal, or waiting for the range to go out of range or high or low, to show up high or low on their test. And that helps me to see what systems are at a balance. And when I start seeing patterns like the glucose, the adrenals, the digestion, the toxin levels, or the liver. Like when I start seeing a lot of patterns, even if they don't have a TSH or a full thyroid panel, I can start thinking thyroid, right? Because I know that some of the causes of thyroid imbalance are the digestion, the blood sugar, anemia, all of these other conditions. And so when I see that picture show up, I can say, okay, now if you don't have, because many people show up to me with labs already, I'm not going to run another set of labs before I've analyzed the labs that they have, because it just makes sense. First of all, we want to save them time and we want to save them money, but I'm going to fill in those gaps, and I'm more than likely going to run them again, but at least I'm running them with a lot more intention. And when that patient sees, wow, this system is out of balance, this system is out of balance, oh my gosh, I've been focused all this time on hair thinning and thinking it was estrogen or testosterone when it's my blood sugar.
Mm.
That's at the top of the list. Or I thought my blood pressure was out of balance, but it's really my cortisol as well, right? And so they start to see the changes and shifts. And that's the important part, because we can't get a patient to do anything unless they really truly buy in.
Right. That's a critical point. And I don't want to go by that fast, because this is an issue. Like I said earlier, you can give them the best protocol in the world and the best plan in the world. But if they don't do it, if they don't buy into it, I love what you said about that. I use a lot of the lab testing, genetic testing, and other things to help people to see with their own eyes that this out of balance is what's contributing to these symptoms. And when they do that, and then this action that you're doing, or this nutrient deficiency is what's contributing, then they go, okay, I'll do it. I'll do it.
And they get another level. We talked about, I'm the fun person, right? So my job is to try and pull the stress and pull all of that out of their world. So as soon as they get the answers, because they're showing up to me because they want a medical detective, right? They want someone who's been digging deep, because I can tell you the majority of people have been to 3, 4, 5 other practitioners. Let me just talk to a patient a few days ago. I'm her 4th naturopathic doctor.
Wow.
Right. And so she was so disheartened. I don't even know how I got her to say yes to do the work, but other than the fact that she's struggling and she needs more answers. So if they see that looks interesting, that kind of fills in some of the gap, makes sense to them. And then they see, I've been focused on the wrong things over here, or I haven't gone deep enough. I've been working at level 1 and level 2, but my work is down here at level 5, 6, and 7. Then they say, okay, I can do this. Because remember, I don't normally work with the person who doesn't even know what a thyroid is or hasn't been doing this. These people show up because they have complex and are unresolved, symptoms. And so they're problem aware, as we say, right? In the marketing
Exactly.
industry.
Yeah, they're aware, and they're problem, and they're kind of solution aware to an extent. They know that there's something out of balance in their hormones. They just don't know what, and they don't know what they can do to get that back in balance.
And another challenge that I find is the pill mentality. The most people think because they've been doing all of these protocols for all these years that they're working on their health, right? And I almost have to pull them back and say to them, I need to get you off of all of those things that you've been taking all these years, right?
That's the hardest part, right? Getting them to take more pills is easy. Getting them to stop their pills is hard.
Isn't that crazy? Isn't it interesting? And because they find a comfort in it, even if they've been taking them for years and don't see much shift and change, just like the security blanket.
Yeah.
And I attribute that to the society that we're definitely in the realm of take a pill. And I worked for the pharmaceutical industry for 10 years before I went to naturopathic school. So I'm quite aware
of the pill for this, a pill for an ill, this for that approach.
Yeah. And I'm not anti-medication, because some people need it and some people need it now. Right.
Yeah. Oh, yeah. There's life-saving things. Right. But it's when it's the wrong medication and it's given in lieu of really solving it, like kind of shuts the symptoms down. But then we go, okay. And then we don't really fix the cause. And then the house burns down. Right.
Yeah.
So, that's what we have to avoid.
And with thyroid issues, for those who are not just in the earlier stages or not possibly have been diagnosed with a thyroid issue, but those who have officially been diagnosed tend to be on medication and long-term use. Like I know people who've been on medication for 20, 30 years, thyroid meds.
Wow.
And so, and we know that after a certain period of time, the hormones are saying, well, if you're taking all these hormones,
why do we have to make them? Why do I do the work and make them for you? You're already doing this. I'm gonna go to snooze for a while.
Exactly. So there's so much connection to taking something, but especially with the medication, that there's so many thyroid conditions that don't even respond, or the cause isn't at that hormone taking level, right? So giving them a hormone is not just stopping the progress, but could be harming them as well.
Yes. I want to talk more about that because, there's what I consider the three most overlooked causes of thyroid symptoms. Are not even really related to the thyroid itself. So I think about thyroid conversion from T4 to T3. Where's that related to? The gut, the liver, thyroid resistance, right? Cellular resistance, just like insulin resistance. What's that related to? Nutrient imbalances, inflammation, cortisol problems, right? And then the third one is actually autoimmune, which is so overlooked, right? Hashimoto's or Graves. And those aren't related to the thyroid. The thyroid's the target. It's accepting the bullets, and the symptoms present like thyroid. But if we try to fix it by giving a thyroid hormone, like you said, the fire keeps burning. And at one point it's going to burn them down. So talk about like how often do you see those situations happen and how do you assess for those situations?
This is kind of a sticky wicket, but I see that person 85 to 90% of the time. They've been even to their official endocrinologist. They've been getting blood work every 8 weeks, every 12 weeks to adjust their T4 levels, and their hair still falling out, their weight is still rising, right? Like all the issues. And so they're not as difficult to shift because they've been doing something for a while. They see it's not working. They searched me out to find an alternative or a new way. It's the people who are in the middle, the fence. Like I get a lot of, I just get maybe 10% or 15 or fence sitters who haven't quite yet gone on medication, but their doctor's trying to get them on the meds, right? And I for some reason or another, I must have the neon sign, don't take meds. Because people show up like, I want off my meds, or, I don't want to take these things. And I have to first give them listen, if you're on meds, I don't have the authority to take you off. So let's start there. But the key is that they're on multiple meds, right? It's not that they're just on thyroid hormones. They're on insulin regulating hormones or medication. They've been taking antibiotics for infections, and inflammation. They're just over medicated at some level. And so it's hard because I have to let them know that, you continue to take what we take, but we're working at such a deep level. We're getting to the cellular inflammation. We're getting to root cause, that whatever you're taking now, your body will heal your way off of it.
And work with your doctor, right? Work with your doctor who prescribed it, because you want to be evaluated, because you may not need the same doses after you fix the underlying. Yes.
Exactly. So because they've been on them for so long, they really went off, and I have to kind of slow them down.
Right.
Just like your body has gone through this experience, there was a 10, 20, 30 year process to create the disease. There's going to be a process for your body to move through the stages of healing. Now you will feel better very quickly. Normally people feel better
if they do what you tell them to do, right?
Exactly. But the tissue changes, the regeneration, like the things that have to happen at a cellular level, take time. take time. And so people do recognize from the very beginning, I don't pull punches. I let them know from the very beginning, this is a journey. This is our work together. And I can tell you it is probably 75% of them show up with blood sugar, at least in the top two systems that are out of balance. Maybe 40 to 50% might show up with GI imbalances in that top two, because that the system that we use to analyze doesn't do a really good job at analyzing cortisol. Cortisol doesn't necessarily, or adrenals don't necessarily show up in that profile, but I run the saliva cortisol in the very beginning so that they see where their stress level is also affecting their health. And that's really where we start.
And those are the things, so those are different, right? So you're starting outside of the thyroid. You're not saying, I have a magic pill, don't take that hormone, take this herb instead. I mean, although herbs may play a role, I'm guessing, right? And acupressure points and all that play a role. But we're saying basically, you've got to get these other things under control. And if you don't, your thyroid's never going to get healed.
Yes. And I think that for those who have been doing all or quote unquote most of the work that an average thyroid patient would do, right? Mm-hmm. Taking the medication, trying to watch their diet, exercising, doing certain things that are general thyroid solutions. Yeah. And if they've been doing them for years or even months and they haven't gotten any results, then telling them that the cause is somewhere outside of the thyroid makes sense to them. Now, to get to the mental, emotional, spiritual piece, some come ready, right? Some in those first two conversations, they are ready. They're there. The meditation practice is high, all of the things that, but a lot of them don't recognize that the lifestyle issues that show up. And I start with those. We start with what you call them the freedom pillars, right? We start with that as the shift and change for their habits, right? Because those things that they do every day are the things that have contributed to the disease all, throughout their lives. And so most of them expect me after all of the analysis to say, okay, take these 9,000 supplements. Because they're used to coming out with grocery bags of supplements,
right? Yeah.
And when we say, okay, well, we have just your sleep is the thing that's the furthest out of balance. We have to work on your sleep. And they're like, I'm paying you to help me with my sleep.
Oh, worse than that is when you say you got to drink more water and you say, I just paid you to tell me to drink more water. But how do you heal if you're not hydrated, right?
And the number of the shifts and the changes that happen with just addressing the water, pulling the toxins out or reducing exposure to the toxins, shifting the sleep, getting movement, because most of them are moving too much. Most of them have bought into that. I have to go to the gym and I have to work out for 2 hours and push my body past capacity. And they don't realize they're pushing their cortisol up and causing even more imbalance in their hormones and not getting their growth hormone to raise at all. Right?
Right.
Most of them are doing too much. Remember, from the earlier part of our conversation, I attract drivers. So I attract people who are doing. They're doing for them, they're doing for everybody else, but they're not sitting around. They're doing. So usually they're doing too much. So my job is to help slow them down and reconnect them back to self, back to ground them. Get them to put their feet on the ground and take their shoes off and, hug trees and, just to get them reconnected back to the earth's circadian rhythm and just do as much as they can to be. Because you guys familiar with Louise Hay, Heal Your Body?
Yeah.
I love this little book. It is just the best book in the world. And I'm always going to give them their mantra and tell them where their imbalance is. So with hypothyroid, one is giving up and feeling hopelessly stifled. Hypoglycemia is overwhelmed by the burdens in life, right? So these are deep-rooted issues that a supplement will never solve, right?
Right.
Never,
I love that.
never in a million years.
No,
right?
it won't, because if that's not the cause, yeah, it might help to allay the symptoms for a little while, but it's
Yeah.
not addressing the cause. And that's where I love you saying that, because we talk about the naturopaths and functional medicine, and I'm not saying anything against, but if
No,
that's how you've been trained in that, a lot of times it's still the this for that approach, but
Yeah.
the tools you're using, hydrotherapy, herbs, supplements, etc., are different, but what you're talking about here is we have to spend the time to dig through all this to get to the real root. And who better than a hyperachiever like you to teach people to slow down, right? It's like,
I'm still learning too.
Because you're still learning, right? And you relate to it, right?
So interesting. I had a patient that just did her labs, and she was even outside of the realm of what I would normally like severe autoimmune imbalances. I almost didn't take her because she was so severe. And I said, well, and she's like, pretty much I have nobody else to go to. You're it. And just a few weeks ago, you could just see, because I'm doing virtual consults mostly, and you could just see the beaming and hear the tone in her voice, how before she had no air. Right? You could barely hear her voice, and she was just so sad all the time, and she just couldn't function. And she's just bright and bubbly, and she got her MRIs back, and the MRI said improvement.
Yay.
Right?
That's big.
When they were telling her she needed lung transplants and all kinds of stuff, right? Literally. And she had such severe autoimmune, I mean, just starting to eat away at so many different organs, including her thyroid. And so she didn't have the resources to do a lot of the big work. And I was running a thyroid program at the time, an 8-week program. And I said, I know you don't believe this, but the work that we're going to be doing there is grassroots. It is foundational. And it doesn't matter whether I say thyroid to you or whether I say autoimmune to you, or I say, this is where your work is. It is here. It is at these pillars. And if we can get your blood sugar, if we can get your digestion, we can start working on the inflammation. We can get you to stop stressing so much. We can do this work. I can guarantee you that you will see a shift. It doesn't matter whether the name on the program says thyroid, because these are conditions that are pervasive and things that support the body no matter where you are. And that's why starting with those pillars, the sleep, the hydration, the removing the toxins, the having fun, the movement, like all of those things, and the diet, of course.
Of course.
Right? Of course, I tell them nobody gets out without that. And if she was not, I told her, I said, I need to screenshot your face. I just want to screenshot the big old smile on your face, because she thought she was going in for a lung transplant. She thought that her lupus and all kinds of autoimmune issues, she thought that she was 40 years old or 30 plus years old and preparing herself to die.
Wow.
So when I attract people who see the content in relation to thyroid, those symptoms, the tentacles reach out to so many different conditions that I end up, supporting people in so many different ways, right? In so many different conditions. It's
Lisa, this has been amazing. I wish we could go on for another hour, because there are so many things you and I could just keep talking about, but unfortunately our time has come to say goodbye. But let's leave people with as they're approaching, and some people who are listening are naturopaths, some are chiropractors, some are nurse practitioners, and some are just conventionally trained medical doctors who are seeing the limitations of what they learned and saying, I need something else. So let's leave them with a few parting words of wisdom.
Sure. I think that I would go back, number one, to what led me to study the medicine that you're studying in the first place. Something said to you, I want to do things differently than what I see in the general medical society, right? Like something pulled you there was some kind of passion that pulled you to do something different, to go back to that experience and that feeling in the work, not to be swept up maybe by all of the information that you learned in school that kind of took you down science-based natural medicine and this and this and that. Yeah, you're going to learn that. You're going to do it. Everything is great. That's wonderful. But for me, I feel like the connection, the heart, the helping them reconnect to self and to spirit, it will really deepen your connection with them, deepen your connection to self, help you get much, much more fast results. And it will ultimately, I would think it differentiates you from all the other practitioners who have kind of fallen back on just what they learned. And again, that's why I love your work, Dr. Rita Marie, because you not just, I mean, I know because I've done your programs as a client, right? You have the same level of dedication and connection to your practitioners. So you bring the heart that you have, that I know you have for your patients. You bring that to your educational experience, to the NAPT programs and all of that. And it's almost like you force people, not like, you don't pull them down.
Coercion.
But you force them to reconnect with, or to continue connecting with a deeper sense of themselves, right, by just saying, let go and release the sole purpose of giving someone a supplement, an herb, and let's look deeper. Let's go deeper. I think that is the differentiating factor between what you teach and what others teach. I think people who know that are attracted to your work and attracted to doing the additional clinical study with you. So, yeah.
Well, thank you for that. And I so appreciate that. I appreciate hearing that back, because that's what I put into it. And I love that you're saying that. And I just so appreciate you and what you put in. And that's why I invited you here, because yeah, if you were expecting to hear the clinical approach to thyroid and what herbs and what acupuncture points and all that, that's not what we're here for. Yes, those things are important. Of course, we're not saying those things aren't important, but you really have to go deeper, because a lot of the people you're going to see have already tried it all. And yes, how can you differentiate yourself and give them something different, right?
Yes. And the scientific, we can go into NF kappa beta and right.
We can talk about all that. And we do that in the program, but we
can go all the way there, right? But
yes,
how many podcasts and how much continuing education are you going to really see that helps you to get the next level of support? Because that's information that, quite frankly, most of my patients have probably Googled already, right?
Yeah. They come in and they want to ask you about what about rhodiola? Do you think that would be good for me? Yeah, right. Exactly. So it's a complex situation. Thyroid is very complex. And what Dr. Lewis is talking about is the idea that we can't just treat a thyroid problem. We can't just say, oh, they have thyroid problems. What herbs can I do instead of the T4 because they want to get off of it? It's much deeper than that. And if you don't fix the underlying, we have a pyramid process that I teach in the Nutritional Endocrinology method, is like, if you don't get the base things at the pyramid balanced, if you don't get the blood sugar balance and the digestion balance, get the stress levels under control and the cortisol, poor thyroid doesn't have a fighting chance no matter what herbs you give, right? So we have to look at that. And then the pillars is just part of the method that we teach. And it's like, I call them the freedom pillars, right? You start with fun and rest and exercise and environmental cleanup and the diet, the outlook, the attitudes, and the mindfulness practices that address the stress. And when you look at all of those pieces and you get those things balanced, and then you look at the blood sugar and by the time you get to like, oh, let's do some thyroid work, oftentimes it's already done. And I have somebody, you mentioned a patient with lung transplant almost, but we've had people come in because their blood sugar was shooting up high and address that. And suddenly their Hashimoto's is gone. Their cortisol levels are normalized and all that other stuff goes into remission, so to speak, and it works. So I just so appreciate appreciate you being here today. On the show notes page, you're going to find links so that you can follow up with her. I highly recommend you follow her on Facebook, Instagram, whatever else. And, watch how she does these challenges. Watch how she communicates with patients. And that's going to teach you a whole lot about how you can put these things into practice. So I believe that the more you master the art of teaching and empowering your patients, your clients in the power of lifestyle and nutrition to restore the balance to their bodies and restore their health and hormones as a result of their choices, the greater the success you're going to have in your practice. And when you empower them, right? You empower them to achieve their health and wellness goals. You're going to feel fulfilled at the end of the day instead of frustrated because they're not responding, right? Right.
Yeah.
And your practice is going to thrive. And that's what we're here for.
And then you'll be happier too.
Of
right?
course.
Right?
Of
because
course.
you as a practitioner will be happier too, because you're not just here to just serve, you're here to also thrive as well. So it's because there's a lot of practitioner burnout and all kinds of other things, right? And so
absolutely.
And as well, and they know that it's a journey. They'll be willing to work with you for longer periods of time, not just visit by visit by visit by visit, right?
Exactly.
So there's so much to it that will make your life as a practitioner easier, make their journey simpler, and help everyone all around. So
thank you. Remember to go to the show notes page and check out Dr. Lewis, and then download the energy guide I put together at reinventhealthcare.com/energy. Lots of great stuff in there. And look at the notes. There's a lot of other resources for you to become that practitioner that everybody's calling, like one of my patients gets on every time I do a webinar. In my house, you're the miracle worker. No, I'm not the miracle worker. The body is the miracle, and we are the facilitators of that. And we allow that healing process to come through, and our patients love us. So until next time, shine on.